Sir, we would like to know what is high tibial osteotomy?
High tibial osteotomy is a corrective osteotomy. When we say corrective osteotomy means whenever there is a bow leg or knock knees, we correct the deformity by opening a wedge kind of a triangular kind of bone and then we fix it with a plate. Usually this procedure is done for Varus deformity, means the bow legs. Sometimes bow legs associated with previous failed ACL surgeries. Sometimes degenerative means age-related osteoarthritis with meniscus root problem, root tear with bow legs. Either only a high tibial osteotomy or associated with other conditions of ligament and meniscus. So this is a kind of knee preservative procedure.
So, who are the ideal candidates?
Ideal candidates are those who have no knee osteoarthritis or very mild knee osteoarthritis. Bone should not be touching another bone, means tibia should not be touching the femur. When there is no such arthritis, we would like to postpone the development of arthritis. So those are the candidates who in future going to develop arthritis because of wrong axis of the weight bearing of the lower limb, for whom if we correct the axis, weight bearing will be shifted to other side and the arthritis will not develop. They are the candidates.
Sir, who are the candidates who you would avoid this kind of procedure?
Okay. Whom we avoid HTO.
Yes, sir.
If there is already bone on bone disease,
Okay.
if there is already bone on bone disease, then it may not be helpful. To obese patients, even after doing, we may not be able to open the joint line. There's something like a inflammatory arthritis, means rheumatoid arthritis or some other kind of arthritis from the blood-borne arthritis, not a weight-bearing or a degenerative arthritis. Those are the people we avoid this procedure.
Okay, sir. Sir, what are the results of the this
HTO.
on short term and long term results? What do you
Short-term results means 1 to 2 months they will take some time to recover, means to walk without any support. They will be walking from second day also, but it will take 3 to 4 weeks for them to walk without supports. We can expect good results for up to 10 years, 15 years also. We can postpone the knee replacement for 10 to 15 years if we have selected the patient who is very much ideal for this procedure. If they are not ideal for this procedure, then it may not be helpful in long run, means it may be helpful for first 5 years, 8 years. The results are, if the selection of patient is good, then it is good, has good results and good execution of the surgery.
Okay, thank you, sir.
Thank you very much.